Hello guys, I hope you're having a great time. Today we're going to talk about typhoid fever. Well, typhoid fever is a generalized infection caused by a bacteria called Salmonella. These bacteria enter the body generally through the digestive tract and then reach the lymphatic system. From there, they enter the blood. The transmission of this bacteria occurs via the fecal oral route. That is, the bacteria are ingested through the mouth after having been in contact with contaminated fecal matter. This contamination can occur directly, notably through dirty hands, contact with infected stool, or soiled laundry. But the indirect mode of transmission, especially through contaminated water or food, is much more common, particularly in regions where hygiene is insufficient. Although typhoid fever is not always considered as a very serious disease, it can nevertheless lead to potentially fatal complications if it's not diagnosed and treated in time. Some people are more at risk of developing a severe form. This includes immunocompromised individuals, that is, whose immune defense are weakened, in the extreme of age, very young children and elderly people, plus patients with sickle cell disease. The development of typhoid fever in the body follows several well-defined stages, which explain the gradual appearance of symptoms. The first phase, which is the incubation phase, which corresponds to the silent period between the entry of the bacteria into the body and the appearance of the first sign. This phase begins with the oral ingestion of the bacteria. The second stage, which is the state phase, which corresponds to the active phase of the disease. The immune system then comes into play, notably through a response called cellular immunity by a process of bacterial lysis. However, this destruction releases into the body a substance called endotoxin. These toxins can have harmful effects on various organs and cause visceral complications. In the majority of cases, typhoid fever evolves favorably, especially if it's treated promptly with appropriate antibiotics therapy. However, even in the case of positive evolution, close medical monitoring remains essential. Typhoid fever can lead to serious complications, especially in the absence of treatment or in vulnerable individuals. Digestive complications are the most frequent and most feared. Digestive hemorrhagia can be observed, sometimes subtle, but potentially leading to severe anemia. The most serious complication is intestinal perforation, which can cause peritonitis. Other digestive complications include cholecystitis, as well as liver or spleen abscesses. Cardiac complications are rare but potentially fatal. These may include myocarditis, cardiac shock, or acute endocarditis, which is an infection of the inner lining of the heart. On the neurological level, certain severe forms can cause encephalitis or other infections such as lymphocytic meningitis or brain abscesses or subdural empyema. The bones and joints may also be affected, with cases of osteitis or septic arteritis. Finally, other various complications may appear, such as urinary tract infections, renal abscesses, salpingitis, which is the infection of the fallopian tubes, or prostatitis. It is reassuring to note that the lethality, meaning the risk of death related to the disease, remains very low, except in particularly vulnerable individuals, as we said before. We'll talk about the positive diagnosis, clinical symptoms, and other stuffs in the following video. Thank you so much for watching till the end, and I'll see you in the next one.